start the meeting with the healthcare system. What it is that we need to do to make our healthcare system effective, because people are really having issues with healthcare when it comes to our system that we have in place right now. There hasn't been much improvement. People are dying in the hospitals. People are dying in homes because they fear that when they go to the hospital, they wouldn't get treated. People are dying um, in their hospital beds, in the clinics, especially pregnant women, and they are not getting helped the way they need to. There is shortage of medicines. Expertise is lacking, and then the way healthcare system is managed is not effective. So all these are tied together, and then all this give Gambian people populace an issue when it comes to maintaining their health. So we need to revisit this and give, our 2 cents, and also give recommendations where recommendations are needed, and see if those could be helpful, especially those in the government. And then what the precautions that we need to take as citizens to be able to maintain our health, so that we can have good health and be able to do the things that we need to do. So when it comes to the drainage system, we can talk about you know the rainwater falls that is destroying many homes, flooding many homes, and also causing health risk to the people of the Gambia. So these are very important, because without a healthy populace, definitely we don't have healthy country, and we cannot have a nation that is developed. So I will let you start, and we're gonna be going back and forth on this subject. So I will be coming in. If you want to tie two things together, which is the health sector and then the drainage, we can do that. Or if you want to specify in one area and then come back to the other one, you have the floor. Thank you.
Well, thank you, Mr. Sawani. Thanks for the introduction and you know, um, bringing the topic up. Healthcare is a very, very important part of our lives. And I think we can talk about them separately. We can talk about the healthcare system first and then go to the drainage system. Even though there could be a connection there, I'd like to focus on healthcare first and then go to the drainage system because bad drainage system can really contaminate our drinking waters and make people sick. So it's part of health as well. So two good topics to discuss. First, I want to talk about healthcare. And as we can see, we all know in Gambia, the healthcare system is really bad, very, very bad. And healthcare should have been a top priority for every government. When the Barrow government started, you know, I know they came in as a coalition government, and coalition government they had their own agenda and their manifesto and the MOU and things that they needed to do. And we noticed that the president diverted from that and started doing his own things. Well, if I were him, uh, I would have focused on healthcare. That would have been a top priority because every government, any government, when you take a country, you really need to look at what are the problems of that country that you can fix and prioritize them in different buckets: bucket A, bucket B, and bucket C. You may go to D, but at least bucket C. And priority bucket A will have your priorities. Priority A, which are the first ones that you're going to handle, because if you don't take care of those, they can lead into something else that could be either a catastrophe or something that may not be good, may have some impact on the community. So that's where you start. And then you go to the priority B list, and then priority C list are things that can really wait. A B can wait until the A list is done. And A list, in my opinion, should have been healthcare in Gambia, should have been on that list. Instead of building roads, is good to build roads. It's good to have good infrastructure. That's also important. But where do you have the roads is one thing. You can build a road um, in the URD or URR, for example, somewhere, which can be important and be good for those people. But if you think about it, healthcare should take priority over that. So the focus should be on healthcare. Now, when I go to healthcare, I look at Gambia hospitals, the hospital administration. I think I've said this before in the past, really need to be dissolved and then restart all over. Get the right people there with the right mindset that's going to move us forward. Because even in America, if you have a group of people leading a company, you have leaders in a company and that don't move the company forward. What happened? They change them. They move them and get new people that are going to make a difference. So we cannot continue to operate like the way the hospitals are in Gambia. Uh, Number one, they're not clean. I would say that the hospitals themselves are sick, and you can't go cure, take care, treat people in a sick location because the hospitals are, in my opinion, they are really not clean to the standard they need to be, not well taken care of. They don't have the equipment, they don't have the supplies and all of that, and a good customer service in there. All of these are lacking there. So you need a board of directors that are going to focus on the hospital and look at what are our problems in our hospitals and prioritize them and see what they can do to make change. Number one, how can we make the hospitals clean, affordable to people, but also have all the supplies, have all the supplies and equipment that they need so they can function the way they need to function, just like the hospitals in the neighboring countries like Senegal, because Gambians are leaving Gambia going to Senegal to for treatment because Gambia is not equipped with what they need to have. So what are we lacking in the Gambia? This is what the hospital administrators, the board of directors need to look at and see, why are people going to Senegal? Why are people going to Gambia? I mean, to Dakar? Why are people flying, going overseas, and not very many people can afford that? Only people in the top administration can do that. So look at all of those reasons why they're going out of the country and bring those reasons to our country, bring them in there so we can take care of our people in our own country, uh, by providing all the necessities in the hospital, proper training, good doctors, good nurses, provide a good customer service there, because there's really not very good customer service in our hospitals. And if we can just start with the two major hospitals, Banjul and Bansang, for example, and take care of it, because the people, these are the two final destinations for people that they have to go to when they cannot get the treatment they need in their own communities. Their hope is to go to Banjul, or there are people up in rural areas. Their hope is to go to Bansang. If they go to Bansang, Bansang can't do what they need. They refer them to RVH. So RVH should be the final destination where people can go and get the treatment they need. Um, if you look at supplies, and I said this before, the hospital need to have a good inventory management system. They need to have good asset management system. If you don't manage your assets, things will come in and they will disappear. They will disappear. And how do you manage assets? You look at everything, you do an inventory of all your assets. Go into the hospital. They need to be able to look at all the beds they have, everything that they have in the hospital, all the equipment. Every equipment has a serial number. They need to track those serial numbers, computerize them, so that if they become missing, they will be able to locate them somewhere, because nobody else should have that. That way they won't, equipment and supplies will not be missing and going to somebody else's pharmacy. And as part of the restructuring of the board of directors, I think there should be a policy that says that if you work in the hospital as a board of director, or you have a connection with the hospital, you should not own a pharmacy, because that's a conflict of interest. People that and the board of directors in the hospital or doctors in the hospital also have a pharmacy outside, guess what? When medicine comes, the supplies come, they will find a way. Not all of them. There are some
Right,
very
right, right,
honest Gambians
right.
out there.
Yeah.
Okay, don't get me wrong. There are very honest Gambians. There are people that are afraid of God, but there are people that don't think about God in this world. They think about God after they die. So,
When it's
so
too late.
ones that really don't think about God, what they are doing is, you know, they find a way to get this hospital inventory transferred to their hospitals, to the sorry, to their pharmacies and clinics, and that shouldn't be happening. That's wrong. I mean, that's very wrong to Gambian people. People are coming for those medicines, and they're already in somebody else's pharmacy. You see, this is why the board of directors need to have very firm rules. They need to have policies and procedures, a standard operating procedure, whereby number one, if you're a board of director, and also if you're a doctor or a nurse in this hospital, you cannot own a pharmacy. Period. That should be part of their
Right,
policy,
right,
so we
right.
can avoid conflict of interest. And two, everything that comes for the hospital for the hospital should be tracked. They should have asset management where they track all the serial numbers, and they should have inventory management system. I mean, that's a system they need to bring, a computerized system that tracks the inventory. Everything that comes in gets scanned. The inventory,
Right.
they look at the manifesto. If it says you have, say, $1 million worth of medicine, we need to make sure that $1 million of medicine get received and stored in our storage area for hospital storage. Then the hospital pharmacy should be getting their inventory from that storage, and all of that need to be tracked. Who went in and who got what? Everything should be computerized. Everything should be on a scanning system, and everything should be tracked by cameras. They should have cameras in the storage, inside the pharmacy, in the hospital, everywhere except where privacy needs to be secured.
Right.
So this is what they need to do to be able to link all of that and be able to control the inventory that comes to the hospital. But it really needs to start from the top. The top need to hold themselves accountable and do the right thing to make sure that there's no conflict of interest before they can hold the bottom people accountable. And
Accountable. Yeah.
also, really have a standard. Like I said, a standard. There should be people that are hired to take care of the hospital. They should have their own maintenance people. The board of directors need to make sure that all of this is happening. If you go around and you see a paint being scratched somewhere, the maintenance people's job is to go fix that. Okay, then they should have cleaners that takes care of all the hospital, cleaning up every single room in the hospital, all the bathrooms. The restrooms should be clean and refreshed every single day, and they is a 24-hour operation. They should have a first shift, second shift, and third shift that goes in and with a checklist to make sure that every restroom is being cleaned every hour, and they have all the supplies there: running water, tissue paper for people, also, of course, hand soap. So people need to. It is like in America, you cannot even open a restaurant when you don't have a hand sink.
Right,
In that
right, right,
hand sink
right,
is a requirement. Every
right.
hand sink must have a hot and cold running water. Every hand sink must have a dryer where people, a means of people drying hands, whether it's a dryer attached to the wall with an electric one or a paper towel that people can dry their hands with. Every hand sink must also have um, a soap. You cannot have if a health department person walks into any place today in America and there's no soap for people to wash their hands, they will be in violation. Just that easy. And another thing, hospital is a place to treat people, sick people. So every individual that walks that works in the hospital really need to be a very clean person, need to be a person that takes good care of themselves before they can touch people. Hand washing is a must.
And they
That's
have
why in
they
every
probably have to get a glove. I've seen that happen also. They have
yep,
gloves available. Yeah.
good. And every hand sink also has a must have a sign that says employees must wash their hands before returning to work. These are requirements in America. They are standard operating procedure. It has to have all of those so that we can keep people, hold people accountable to what they need to do. Supplies are available, everything's available. I mean, in talking about inventory management, I won't even get into that because that will take a long time to talk about that. But there are systems in place that they can manage their inventory so nothing is missing. That includes accounting, audits, frequent audit. Every month, somebody need to go count that inventory to see what was sold, what came in. So first starting with what came in, how much was received to make sure there's no discrepancy in there, and what was scanned out and how much should have been left in the inventory. They should be doing that, counting, auditing, and reconciling the inventory frequently so they know if there's a problem, they can catch it soon enough and get rid of the source rather than continue to be in there without medicine or supplies for people. So, it's a long topic and there's so much into it that we can't talk all about that now today. But I just want to give that. I know I've been talking too much, but I just want
No,
to throw that out there.
yeah, thanks, Sam, for that. So what we're gonna go, we're gonna break it up into pieces here, right? So you spoke about the accountability factor, the medicines. I mean, like, make sure that their inventory is carried out. Make sure that people are also assigned to clean. The cleaners and people who are responsible need to clean the facilities, especially in the hospitals, right? And then have make sure that hand washing procedures, even before COVID, this hand washing is there, but people haven't really explored it, or people were not really subjected to it because they never think that hand washing is that of a big deal. But hand washing actually kill 90 something percent of the germs. So if it is a practice that we do, then we are actually eliminating. We are eliminating a lot of health risk, and we are also like protecting ourselves from possibly getting sick because of what we touch. So what I'm trying to say here is that we need an enforcer in this case. We need somebody who would be on top of um, his or her game to make sure that these things are implemented. Because the problem in the Gambia is not about ideas. I always say that. It's a lot of Gambians who have a lot of great ideas, great ideas, but the problem becomes implementing it. The ideas is thrown out there. People who need to implement the ideas will never do so because they don't actually either believe in it or they don't care. So starting from the top to the bottom, the ideas are there. Every day people are in social media. People are, talking about good ideas, but nobody is implementing them. It is kind of like a loose opportunity here. So the fact of the matter is we can put out all these things, but the people in charge in hospitals need to make sure that these are applied. In the government, they have to make sure that they supervise and make everybody accountable, especially in the clinics, making sure people, are accounting for everything coming in, especially medicines, because we have reports that some medical staffs do actually take these medicines to their pharmacies, and these are public medicines. These are people who are poor and cannot afford healthcare. So this thing needs to go to them. If you have a clinic, nobody said you shouldn't have a clinic. I mean, I know you mentioned that they should make sure that the person who works in the hospital, doctors and so, don't have clinics. But I don't know how that could translate, when it comes to like people's right to own things and so forth. But what we can say is that there should be a scrutiny, making sure that everyone that is working in the hospitals, they're accounting for everything that comes in, so that it is going to the right people. I guess that's the best approach here, if you will agree with me.
Yes, it's when we've been operating since independence, if you think about since independence up to now, hospitals have always been a problem in Gambia. We've never had enough of what we need. People continue to fly out to go to Dakar, the ones that can afford it or go overseas. And the ones that can't afford it, they will just die with the illness. That's what happened. So somebody need to make that hard decision and take responsibility and make a change. And in making the change, you have to make a difficult decision. It's going to impact some people, but do it right for the country. That's what's important. We do the right thing for the country. When I say conflict of interest, yes, if you work in the hospital, you really and you're a doctor in a hospital, and we want your 100% attention on our people. We don't want you to be coming late to work because you have a clinic at home. We don't want you to come to work and be in a hurry to go home, come take care of one or two people and go home because you have a clinic at home too. That's not going to work. We need to have, we need to have doctors that are going to focus on our people, pay them right, give them what they need to have, let them focus on our people, let them do the job there and not try to run between two different places. That's not going to work. Okay. If you want to own your clinic, that's fine. Own your own clinic, but we don't want you to work in our hospital. We need to get doctors that are going to focus 100% on our clinic, on our hospital, and on our hospitals, and be able to come to work on time. Doctors should not be sitting at home till 10 o'clock and 11 o'clock and show up to work when patients have been there since 6 a.m. waiting. That shouldn't be happening. So that's why I said the leaders need to make that decision, to make sure you make the hard decision, make sure the right thing is done for the right people, or for our people. Otherwise, again, those who can afford it, that's why they're going out. Those who cannot afford it, that's why those people are dying, because they're not getting the help they need. So somebody need to make that decision, make that hard decision, and make that change so we can be just like Dakar. That's why I
Yeah,
said that, and that need to happen.
right. So talking about Dakar, we have observed that many Gambians go to Dakar after suffering from sicknesses that they think Gambia cannot handle. And then eventually when they go to Dakar, still the same situation happen. They end up, dying over there. What is the mindset? Is it that they think, well, when they go to Dakar, they will get cured? And is it that, oh, they don't have confidence in Gambian doctors, or we don't have the facility in place?
Healthcare is deep, and we are not doctors. We can't tell why, but what I can say is, you know, primary care is very important for everybody to take care of yourself, from and even our children from childhood. Make sure you do all your medical checks. Everyone, especially when you grow up, we're all gonna get older. Nobody gets younger. We all grow older. So we need to take care of ourselves by having primary physicians that we can visit and do our healthcare check, and not wait until something is completely out of control and then go to the hospital. If you go to the hospital and it's already out of control because you've never been to the hospital, well, guess what? Gambia is not going to be able to cure it. You find funds and you go to Dakar, you end up dying there because it's too late. It was too late when you get there. So all of that can be one thing. But another reason why people go to Dakar is, one, they know that Gambia hospitals don't have what they need. They don't have the doctors in Gambia. I don't know what kind of doctors we have there now. And I respect their field. I respect them for what they do. Um, they don't, some of them don't really, I would just say hospitals don't have the equipment. They don't have the tools and technology they need to be able to do certain things. That's why, and that's why they're going to Dakar. And also one thing we need to stop in Gambia, it's just like in the US. Being a doctor doesn't mean you know everything, doesn't mean they can do everything. You'll see a doctor that studied one thing and specialized in one thing, but when they go to Gambia, they want to do everything. That's not right. That's not a specialty. And when they want to practice that, there certain things can go wrong because they've not been trained to do that. They were not specialized to do that. So, that's another thing. If you come to America, you have family physicians, people that are specialized in family medical practice. You have gynecologists that are, their job is being a gynecologist. They are not going to do a surgery on somebody on something that has nothing to do with being a gynecologist.
Yeah.
You know, you have pediatricians that focus on children. That's what they do. They have their clinics. They have hospitals have pediatricians. When you go there with your children see the pediatricians, not a brain doctor, or not somebody that started something with a neurosurgeon or something like that. You know, so everyone has their field, and the area of expertise is their area of expertise. They do that very well. If we have Gambian doctors focus on their areas of expertise, they will do very well with that, and not take something that they don't know. This is part of our problem there. And again, we need to have a good system in place, very good doctors that are very well paid, so they don't try to look for money somewhere else. Okay, and give them the tools and technology they need. Computerize the whole system, the whole hospital system. So when somebody comes in, they check in just like in a hotel. You go to a hotel, you check in. You go to a hospital in America, you check in. Your name is in the system. They get your whole information, and every room you go to, they can pull your information in the system and be able to see it, because and they know what brought you to the hospital. You see, all of that need to happen, and that's why, you know, I said we're way behind time. Gambia is way behind time, and somebody need to start something to be able to get us to on the right path, in the right direction. That's what we need to do. It cannot all be Gambia's problems cannot be all solved in one day or under one administration. It's going to take time, but somebody need to start it.
Right. So very good insight. Now you have seen yourself since independence. You've been in the Gambia, work in the government at some point, perhaps, right? If I'm correct. Now you've seen a lot, you know, and then we've been struggling with our healthcare system, and Gambians haven't actually produced doctors, you know, to the capacity that we need. I remember when Jammeh was in office, he used to have Cuban doctors there. Can you hear me clearly?
And if you speak up a little louder, I can hear you.
Okay. I said when Jammeh used to be in power, he used to bring Cuban doctors. So Gambians don't produce, you know, many doctors that are capable enough to do some of these surgical works or some of these take care of these critical issues. What I'm saying is that what is lacking? Is it that our attention hasn't been focused on healthcare, or we don't know what healthcare, you know, can do for us, or we believe in our traditional healthcare, so I mean healthcare system, to the point that we are not making it a priority, because a lot of money comes to the country. Gambia's priority hasn't been the healthcare system. And we all know, if you don't have a healthy populace, you cannot have a healthy economy. People need to be healthy and work and do contribute to the economy. Right now, Gambian people are not really contributing to the economy. Mostly the diaspora support kind of, you know, propel our economy. So what do we need to have Gambian populace healthy? What do we need to do more? Because since independence, we haven't been doing much. And Barrow administration came in with the hope that we should be able to do more, because we have so much grant from World Bank and other places through this COVID. And now we had from the Minister of Health that, you know, those money has been, you know, diverted to multiple names appearing all over the place. So it looks like we have a serious problem. Yes, we don't have the facility, but why don't we have the facility up to now? We have been in independence over 50 years. What is going on with us?
Yes, you know, part of our problem is corruption. Corruption is a big problem, and Gambia is getting worse year after year. It's getting worse there. Corruption need to be controlled. We need to control corruption, and we've not had any president that control corruption yet. That has controlled corruption. I'll put it that way. Jammeh did his part by trying to arrest people that they caught doing something, or mishandle of funds, he will arrest them and put them in mile two and all that stuff. But he himself was very corrupt. He
Right.
himself was dividing all
Of
the funds for
course.
himself. So that's still not fighting corruption. You stopping other people, trying to stop other people to do it, but you're doing it yourself. And you know what? It should be the other way around. Everything starts with the leader. It needs to be from the top. Corruption needs to be fought from the top to the
To the
bottom,
bottom.
not
Yeah.
from bottom up. It needs to be from the top to the bottom. The leader has to be corruption free first, so he can hold people accountable. So that's the way it needs to be. Corruption is really playing a big, significant role in our inability to do certain things. I know Jeremy brought Cuban doctors. The Cuban doctors, again, some of them, from what I heard, I have not met anybody, don't know them, but from what I heard, some of them were, just student doctors. Those are doing their residency. They are trying, they learning as well, and they're learning on our people. Not all of them were very experienced doctors. We need Gambia. I mean, think about it. One life is very important. Losing one life is like you lost everything. We need to do everything to avoid losing lives. And if it means we need to pay doctors a lot more money to get the right doctors in there that are going to focus on people and help Gambia, that's what we need to do. Healthcare should be a priority. It should be a priority for every president, every country. I mean, the healthcare of your people is very, very important. It's very important because we can't afford to have everybody fly out to Senegal or to overseas to go for treatment. They can't afford that. Right now, they're struggling to eat, to feed themselves and feed their families. You know, People that are struggling to feed, you can't expect them to. They don't even think about going to the hospital when they're sick because they think about how much is it going to cost me when they don't have food at home. So it's very important that for the government to really take healthcare seriously and do a complete reform and restructuring to be able to get us where we need to be. Get the right people that are going to hold people themselves accountable first and then hold people accountable. And one thing in Gambia is a follow up. Follow up is a problem in Gambia. You can say all kinds of things and
Yeah.
do all kinds of things, come up with all kinds of ideas. Who is going to follow up is the problem. It's
Right.
always the problem in Gambia. Who is going to follow up? We can build a brand new hospital and put people in there and say, this is what we're going to do. This is how we're going to maintain it. Who is going to follow up to make sure everybody's doing their job? That is a problem for them. And that's where changes need to happen. Changes need to happen by bringing people that are very good in administration. They're very good in holding people accountable, and people that are very good in leading by example. They're going to do it themselves. They're going to hold people accountable, but most importantly, provide proper training. Training is key, is fundamental. Everybody needs to be trained very well so that they can do their job. If you train people well and you put them in place, then you have a supervisor that checks on them and follow up on what they're supposed to do. It will be done. If you don't have anybody holding up, if I put people in the hospital and say, now your responsibility is to maintain this hospital bathrooms, make sure all the restrooms are clean and they have all the supplies every day.
Right.
Well, if I don't go back and check the hospitals, the bathrooms myself to check on that person's work, I have no idea. I won't know what's happening in the hospital in the bathrooms. The bathrooms can be nasty. They can be out of all supplies. And nobody's going to know it because nobody's following. Somebody need to follow up by creating a checklist for these people. Make sure this checklist is getting done. Whoever goes to the bathroom, you check in. You went to the bathroom at 11 o'clock. You're checking to make sure that the bathroom is clean, all supplies available before you walk out. If I have that, and then every hour they're checking that, and I am a supervisor, for example, I'm going to check on my people. That's what supervisors do. You check on your people, hold them accountable, go check their work, go to the restrooms that they said they've already cleaned, and see that if a cleaner comes out of the bathroom, say 11 o'clock, and you happen to show up there 11:15, and you go in there and there's no toilet paper, there's no soap, I mean, and all of those supplies are missing, you should be able to call that person and say, look, you did not do your job. You were supposed to. You went in the bathroom at 11 o'clock and I went there 11:15. Are you telling me a whole roll of toilet paper has been used? Are you telling me the soap is gone? You know, and I know that, you know, every place has to deal with circumstances based on what they can control. There are certain things that they can do to make sure that people are not stealing these or people are not taking anything from there to take it home. There are ways that you can do certain things, and that's what they need to look at. Again, all of that is part of their planning, and this is what the hospital need to look at. You can't just say, I'm a hospital, I put hand soap in the bathroom, and the hand soap is gone, so I'm not going to put any more hand soap. No, you can't do that. You have to put hand soap there. Find a way to secure hand soap so that nobody can take it. Make it a way that nobody can really cannot take it. They can only get soap in their hand, but they cannot take the soap container. Secure it in a way that it cannot go. That's what you need to do. Only hospital staff will have key to open that container and supply liquid soap in there for people to use. If you provide liquid soap, nobody can take that. You're not going to put liquid in your hand and put it in your pocket. You're not going to put liquid in anywhere and try to carry it, because one, you cannot reach that. You cannot open that. You can only get a small amount in your hand, good enough for you to be able to wash your hands. That's it. So they need to come up with all of those and close all the loopholes that is creating loss for them. That's what they need to do. So there's a
Yeah,
lot to be done.
right. So thank you so much for that. Um, Now we look into, the administration of healthcare system in the Gambia. We already specified that, the government and that the folks working on the healthcare should be accountable. They should make sure that everything is accounted for. They should make sure that, like the the people taking care of people are up to par. Somebody just wrote that, what do we expect if people are studying health science in Gambian University, and we expect those people to come and, take care of our sick people? It looks like people are not satisfied with some of the people working in the hospitals because they don't have the expertise. That's why I'm saying that Gambia government should really invest in healthcare system, in social infrastructure instead of building. I understand building roads, building, monuments, building those centers are good things to do, building the airport, but trust me, social infrastructure like healthcare and education, those are the future. You invest in those, you are creating, people with potential. Especially with Gambia, we have a young generation that 60% of the population are youths. So Gambia need to look at youth, healthy youth populace, so that we can produce more in the near future. But if you look at it, most of the work has been done on road construction. I construct this monument, I construct this for political score point. I think we need to be realistic. You know, people need to go to the hospital with confidence that they're gonna get cured. Their problem's gonna get solved, not with the fact that they want to stay home rather than going to the hospital, because when they go to the hospital, they probably will die faster. That is not a good concept. That's not a good idea. That's not a good feeling for somebody to have. And people's healthcare system need to be covered at some point. If you're an employee here in the US, you usually get healthcare coverage. Where are all those healthcare coverage plans? Where are all the plans that is needed for citizens to be able to work and also get protected health wise? But I don't think Gambia has all those in place. It's a lot of restructure that is needed for us to have a healthy healthcare system. Again, we are blessed with a very good environment. We don't have pollution as in the West. We don't have, bad foods, processed food like the West. We can grow on land. We can eat our own thing that we grow. We have all these There is no way that we don't have it, because you walk down this, a few, I mean, a mile or so, you have a farm. So if we are not healthy, we have to really question ourselves. Why? Because we are not exposed to this processed food like in the West. Okay, this processed food give you sicknesses that could cause problems with you later on. Now have the ability to be living in an environment where the air is clean, there is no much pollution, where the farms are available to, I mean, to grow what you can eat, where you can do a lot more to stay healthy. And of course, we should all, what we need to do is to focus on the folks that are going to get sick. How can we provide medicals for them, especially the poor? But I don't think this administration or in the past administration had any plan for this kind of thing. And I think that is what is killing us. you know Somebody need to come in and say, listen, I have a plan. The Gambia healthcare system, and not only in Banjul area, but we want to do this across the board, in Farafenye, in Basse Hospital, in all the clinics. We have to at least have basic things that is needed there. Bansan Hospital, we have to look into all these things and start making improvements on them, so that people, when they get injured, they can get the bandage they need. They can get the treatments they need. They can get the medication. Okay, but people are going through a lot of pain. You go to RVH, as Edward Francis Hospital, you see people laying down, their hand bandage, in pain. There is no anesthesia in them. Okay, they go through surgery like that. I'm telling you, man, that alone can even kill somebody. You see people flies flying all over in a hospital. When you go there, you kind of like get scared. What is going on? So all these things needed to be revisited. Somebody, I mean, and cleanliness, like you said, is a major thing. We have to make sure our hospital environment is clean. If you are in a hospital working there, or you are kind of ahead there, you should make sure that all the things are sanitized. Everything is sanitized. The needles that you're using, the surgery equipment, so that we don't have these transmitted diseases like hepatitis and other transmitted diseases. We have to educate our people. We have to make sure that we focus on our people when they're sick. Because I've had that, like some of the ladies that were taken to, to surgery when they are delivering. Sometimes, there are people working there. They just leave them and go to lunch like that. I mean, and take their time to treat these people. How can you take your time to treat somebody who is in a life and death situation? So this is something that we need to work on. I don't think this is helping. Yeah. So in order to wrap this topic up, we have spoken about the responsibility of the government officials and people working in the hospital, and we also have revisited also the hospital equipments, and inside the hospital what needed to be done. Do you have any more things to add to this so that we can move to the next topic?
Well, I mean, this is a topic that we can go forever and ever on this, and I won't finish, especially when I get to how to manage the inventory at the hospital and the pharmacy is critical. Is a very long process that if I want to talk about that, but and I know that there are times there was a time that they actually had gloves shortage. They were short in gloves. And can you imagine a hospital not having gloves? I mean, and every doctor has to wear gloves. Everyone needs to wear gloves. You cannot touch a patient without gloves on. You need to have your gloves on, and you need to change those gloves after every task. Just like in food service, in food preparation, you change your gloves after every task. So if a hospital runs out of gloves, that's a major issue, because now they will be cross-contaminating things in the hospital. Patients can be patient's disease from one patient can be transferred to another one, and things like that. You can touch a patient with your hand. I hope not. I hope that's not happening. But I know that there was a time that they were short in gloves, and that's serious. That tells me that they're not really managing their inventory. They don't have a good inventory management system, and that's a big concern. And if I look at the hospitals in Gambia, and like I said, you've got to start somewhere. Start with the board of directors, you know, kind of reshuffle them, or not necessarily reshuffle, but reform them by getting them out, get the ones that are not effective, get them out of there and bring new people in that's going to make a difference. And then have that board of directors look at the hospital administration and see, or the whole operation, and see what can we do to change this. Because I can tell you this, an animal clinic in America is better than RVH in Gambia. Believe it or not, an animal clinic where animals go where you take your dog or your cat when you're sick, you walk in there, is cleaner than the hospital in Gambia. And that is sad. Our hospitals are very, 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 I won't say that I'm trying to think of a word to use here, but really we need to up our game. We need to up our game and take good care of our hospital, because this is where we take sick people. If that place is not clean, how do you expect to go take somebody there and take care of them, and you can end up infecting them with something else. They may go with one illness, but they may go home with something else, because the place is not clean. The place does not have supplies. The place does not have the right people with the right mindset, to take care of people. You take your dog to an animal clinic here. They greet your dog. They grab your dog. Some will even kiss your dog. And you go to Gambia, people pretend that, or they even think that you're there to bother them. They want to be on their cell phones. They want to be on Facebook. They want to be doing something else. Some are sitting up drinking a tire when a sick person walks in the door, instead of dropping everything else to take care of that person.
Right.
And this is where leaders need to take action. Leaders need to supervise. You have to inspect what you expect. If you don't inspect what you expect, well, you're not going to get anything good out of it. Supervisors have to be walking in that hospital every single day. If I were the president, I will surprise the hospital. I'll walk in there one day. If I don't see what I like, guess what? I'm going to fire everybody. I'm going to fire the top directors and find a new board of directors, and say, we need people that are going to take care of our people. This is unacceptable. And do something about it. Once you do that, then it will be an eye opener for people. People will know that, you know what? This is not business as usual again anymore. We are serious with our health of our people. We need to do something better for our people. And that's what leaders do. Leaders need to inspect what they expect. So it's a long story, but and it is very sad that our healthcare is like that. And I hope that the government hears this and take action and do something about it and change something, because if they don't change anything, people are going to change them. That's what's going to happen. And we bring a new government, same thing. If they don't do what they're supposed to do, people are going to vote against them and give their vote to somebody else until we get the right people in there. And
Right.
whoever comes in, healthcare should be a priority, should really be a priority, and it need to be addressed. It need to be taken care of, so we can help our poor people that cannot afford to go to Dakar or overseas somewhere else. Yeah.
Exactly. So that brings us to the to that discussion. Now we can visit the drainage system quickly before we close. As you know, Gambia is suffering from the outpour of rains this year. We have a lot of rains, which is a blessing in disguise. It's good to have rain because rain helps us grow our products, our cash crops. So rain is good. I mean, it is a good sign. It also helped fertilize the soil, and people can do a lot of things with rain. Plants can grow. It can make the environment better. But the Gambian rain season this year has really caused a lot of problems, as we have seen in the news. There were a lot of flooding in the Gambia. A lot of flooding, places have been flooded, houses have been flooded to the point that it creates a risk, health risk. So the question is, how can we deal with our drainage system? We know that our environment is not equipped. We don't have the roads that we need. We don't have the kind of infrastructure in place. Every place is dirt, soil everywhere. Water definitely sits when it falls on there, and if it comes in abundance, it will find its roots somewhere else. The roots have been all drained out. You have a lot of holes, a lot of some places when you get there, you think is a trench town. So the question is, what can we do? What is it that this government need to do? And then, of course, as the citizens to help make sure that the rains doesn't actually cause us harm, doesn't get our place flooded. Water can find its way. I know it is really gonna be really really hard, especially in the urban areas where the population is growing every day. So the rural areas maybe will be easier because the water can just seep down to the ground, because we don't have like population problems there, and is a lot of openings, farms and so forth. So probably we don't have water standing in one place, and this because of this rain also, mosquitoes can breed. You can have a lot of issue with mosquitoes coming, like breathing, and then malaria, causing malaria and all that kind of health risk. So what is it that we need to do? I know, you know developmental wise, I mean, it's going to take a long time to have all those, especially in the urban area, all those places concrete, to make sure that waterways are created and lead to the ocean like how it is in the west. But we need to come up with something. Somebody, I think this is under the government, I mean the Ministry of Agriculture, I mean like Ministry of Local Government, something like that. So we need to come up with some ideas how the government can invest in this area and help, so that we don't have a lot of destruction. Where are the areas that are vulnerable? Let's do the soil testing. Let them come with something. Because last year when I went to Gambia, you'll be surprised. I went to Talindin. They took me there. Um, there are some places, right? There are some places, and this is such a weird story. The mayor Talib secretary took me over there, Lamin Sanyang. He showed me some places, some compounds where there is so much water and they are throwing garbage there as well. Imagine, like they throwing a bunch of garbage. People are sitting on top of garbage, and then water there. It's next to, like, if you're standing over there, it's in Talending somewhere. If you stand over there, you see the mangrove in Banjul. So I'm like, how does this people? How this is crazy? How can these people live in this situation? He told me that they're used to it. The kids are playing in a place where there's a garbage and water sitting on it. I said, these people need to be relocated. First of all, why should somebody be dumping waste here? Then they told me, oh, they're dumping waste because they have no place to dump waste, or they cannot carry waste, or there's no waste system at KMC. So these are the kind of things causing us risk when it comes to health. I'm like, what? This is crazy. So the mayor told me that they are working on processes how to do it, because The waste here cannot be managed, and then the people don't have any, and they build compound there on top of the waste. So we have a serious problem. If we are sitting here thinking that, we are okay, we are fooling ourselves. We need to go and look at our country and see some of these things causing us sickness all over the place. That's why sicknesses are coming out. We don't even know. And this has nothing to do with COVID. But there are other things, illnesses generating in our community. We don't know because our environment is toxic. Having a house built in on garbage. Suntukungo. Ngale suntukungo lone. That's what I saw. I have pictures. I can prove it. And I went to Abuko. I mean, not Abuko. I went to where the crocodile. What's the name of the place in Bakau? The same situation. We went to see. We went there, and the ladies are doing gardening at a place near mangrove, and that also a lot of darts going in there. When it rains, a lot of dirts are thrown there, garbages, and the people are doing their gardening there. Okay, I can understand the garbage might give the garden, the plants or the whatever you are gardening, fertilizer. But come on, what about the water? The water sits in there, create mosquitoes to grow. And forget about those gutters in Bakau. People are sitting on top of gutters that are stinking. There's no water moving. So we happened to open the one of the gutters, and I looked through, and I told them there's no water moving here. So why do they have these gutters? Why can't somebody clean it so that the water can move and go to the river? So we don't have any drainage system. To make the story short, we are lacking drainage. Nobody is using their head, and this can be even community from the community standpoint. People can sensitize each other and create and work. Communities are building their countries. If the government is not doing it, my philosophy is, if the government or the people in power are not doing it, let us do it. Let us do it. But if we sit there and don't do it, and we say the government is not doing it, we're blaming them, they don't care. At the end of the day, we are suffering. Let's build our community. Let's come and form community organization. It's a lot of youths come out, dig the place, look for assistance, and come on, let's do our environment. Nga test it okay. Test it nga willing to test it okay in our environment and make it, build it. I think that's what it comes to now. If the government sees that the useless government will start to rethink whoever that government is, because people put them there for a reason. But if we sit there, the way this our country money is going to be distributed, it's not going to be equal. They only put it where they have political agenda. They don't put it where it needs to be. But when I went to Bakau, and the smell of those gutters kind of blew my head up. Trust me, it has nothing to do with anything. It has to do with, we are not taking care of ourselves. How can we live longer if we are not taking care of ourselves? How can our kids live longer? And sometimes this environment develop cancer. It develop all this air you breathe, all these things, radiation. It develops stuff that we don't even know. That's why you need to sweep your area. Gambia need to be having sweeping day, like how Jammeh used to do it. I support that idea. And let nobody litter on the street. Let the mayor and other people kind of create a way where their waste can be transported. What is the hard about that? Gambia has a lot of land. Transport the waste to where people don't live and burn it there. But we are stuck health-wise. And we sitting there dumping stuff, dumping in the gutter. Rain comes, we don't have any plan. It moves some houses, it drops, I see a garbage taken from Sukuda, a garbage by rain, and dumped on where I live. Somebody garbage from Sukuda come all the way from the rain and dump next to me at Bakote. Come on. Is this a joke or what? When comes everybody? One day somebody is going to be floating in that rain, and it's gonna be dumped in Banjul River, if you don't mind, because that's how powerful this, this rains can go. It can move things, not all, it's limited to destroying the house. So I think we can, we can go over this, Sam, and then just wrap it up, because I also have something to come up around 1 o'clock.
Yep, thank you for that, Sony, and thank you. Great insight to that, the drainage system as well. I'm sure the viewers really concur with you, what you just said here. Um, Gambia has a lot of problems. We have a lot of problems, and unfortunately, we can't solve them all at the same time in one time. But somebody's got to start somewhere, and this is where I always say, if you fail to plan, you plan to fail. From the beginning, we did not have proper planning for our system. We didn't have a good proper planning for a lot of things. If you look at drainage can be done naturally and artificially. And the reason I said that is, um, when I think about back in the days when I was young, when it rains, the rainwater will flow on its own and go towards the river because there was plenty of space. There are ways where the water goes. I remember back in the days, and when I was little, we played soccer, and when it's raining, and as children, we go out and play in the rain, right?
Like,
We've all done that. We played in the rain, but we played soccer, and while it's raining, I've done that. While it's raining, playing soccer, and next thing you know is somebody kicked the ball, and the ball ended up on the water path. And we say, oh, the water is taking our football. What we say, woyo, in Madinka, we say, woyo, woyo besa katro sambala. So we all run for this ball because woyo is going with our ball and it's going to take us somewhere. That's the natural way of the water to go. All right. So in these days, in this present generation, when you think about Combo area is densely populated, we did not have very good fiscal planning, and the fiscal planning allowed, and the local government allowed people to sell all of those properties, even the ones on the waterway, were all sold, and we blocked the water. So when it rains, the water has nowhere to go. That's one problem,
mhm.
and that should not have happened. They should have left those natural ways of water to flow and go back into the river, and that way water will not be standing in our communities. The other problem is the drainage system. Just like in America here, there's water filtration system. Sorry, there's water treatment centers. Every community, every town, every city you go to, they have water treatment center where when you flush your toilet, that water goes somewhere. It ends up in the water treatment center where the water treatment will treat that water to make sure the water get purified so that the purified water can be released back into the river and the waste is managed somewhere where it goes somewhere else. Okay. So that the water is not standing in our community. In Gambia, when they built those drainage in there, we blocked them. People blocked them. They blocked them from going anywhere. And they, of course, not a good system there. So they block those. And when they block them, they stand in there, creating a bad odor, a bad smell in the community, creating mosquito nets. Mosquitoes growing in there as well. And that creates a health hazard for people. All of these are things that the health department, the Ministry of Local Government, what is it called, physical planning, all need to work together with the area councils to make sure that these are cleaned out and these are have a waterway for the drainage system to go, and these gutters get cleaned out so that there is an easy flow of water to go to a water treatment center. That way there will not be any standing water, because that standing water not only creates health hazard, not only creates mosquitoes, it creates health hazards too. If I remember correctly, about 6 months ago, or so, there was an E. coli outbreak in America here. Okay, just like coronavirus outbreak, and a coronavirus is something different. Is a worldwide issue, but in food safety, one of the things that I learned there is bacteria and virus can contaminate our hands, can contaminate our food, can contaminate and cause people to get sick and get illness from them. And if you think about E. coli is a bacteria, and then you see a bacteria that can infect people, can really impact our health. There was a time that when that E. coli virus came and bacteria came out, or outbreak came out, the researchers, the FDA, Food and Drug Administration, working with CDC, Center for Disease Control and Prevention, and working with local health departments, they were able to track this and see where it came from. And what they came to find out was that E. coli outbreak was caused by Mexican people, that came to America and work in farms. They go to farms and harvest lettuce, okay, the green leaf lettuce. The lettuce were usually, when they harvest them, they go wash them first. They will wash them and package them and send them out. This is what ends up in grocery stores, and we all go to supermarkets and grocery stores and buy them. Well, there was contaminated lettuce because the lettuce was being washed with contaminated water from a sewer system. That's what they ended up finding out. For some reason, the water that they were using was contaminated with feces. I mean, from people's toilets. And when
Wow.
you think about it, anytime you get a virus or bacterial infection, things like that, they ended up, we pass them. That's why people with diarrhea are not even allowed to go to work in America. If you have a restaurant, you own a restaurant, somebody with a diarrhea cannot come to work. You know why? Because they can contaminate everything in there. They go to the toilet, use the toilet and wash their hands, think they wash their hands, but their hands are not completely clean. They touch something, boom, that bacteria get transmitted to that, get transferred to that. Now they contaminated whatever they touch, everything they touch, they contaminated. Now, but that is something they will pass. As they go to the toilet, they will pass. And so toilet, when you flush a toilet, it goes with those feces. And somebody that has an E. coli infection uses a toilet, you flush a toilet, and that goes in the drainage system. For some reason, that got out because of poor management somewhere, and the Mexican people were using that water that was contaminated with sewer and washing lettuce, and lettuce ended up in supermarkets. A lot of people bought the lettuce and they ate it. They get sick. They got sick. You know why? Because lettuce is not something you cook before you eat.
Exactly. Yeah, yeah,
So
yeah.
if you don't cook it, you cannot kill the bacteria there. So you make salads with them.
Before
A lot of people end up in the hospital.
before you
That's
pass
what
that.
caused that. So now think about Gambia. You think about our drainage system. How many people get sick? How many people get diarrhea that they use a toilet? Or not only that, people go to the toilet in the open, you know, and the rainwater washes that. It goes out. And all of this is a very health safety hazard. It's a safety hazard. It's very, very important. So our drainage system, we need to, again, we need a government that's going to focus on the drainage system. This is very important. It's part of our health. It's very, very, very important that becomes a priority as well for a government to look at what can we do to have a water treatment center, a good water treatment center, start a good drainage system, make it a requirement. In the Cumber area, start there, because everything has to go in phases. You cannot just start something and you want to implement it everywhere. It's not going to work. We have people that are struggling just overseeing a small area, let alone when you give them a large area to oversee. So implement it in the most densely populated area, which is the Cumber area, from Banjul, the capital city, going to Serekunda, Bakau, and all of that area, before you can expand it to Brikama and then up in the country. but there should be a system where every municipality need to be able to track and control and have their wastewater going somewhere. All the trash also get picked up and recycled, or do something with them, recycle them, or have dumping ground for that. But water drainage system is very, very important, that we have a good system, allow toilet flush toilets to go somewhere, allow the dirty water to go somewhere, and compared to the rainwater. Rainwater, we need to open up the natural ways for the rainwater to fly, to flow back into the water, to the river, and avoid any standing water, because standing water can be now contaminated, because you have people, you have children, you have all kinds of people throwing all kinds of things into standing water that contaminates that water. And then the next thing you know, it touches somebody's hand. And you get something out of it, you take it home, and you can end up cross-contaminating something else that we eat. So a lot of health risk there as well. Yep.
Yeah, very good, very good. So Sam, it looks like, running water, drainage system, we need to revisit this, because I think, this is with the Ministry of Local Government and Lands. I think, perhaps we should reach out to them and get them on the show, because this rainy season in almost done, but it has done a lot of damage, and we cannot afford, especially in the combo areas. I have reports of many places being damaged because of the rain. Look at how much destruction is that. You have to go back and build your place, build your house, whilst we can just take care of our drainage system. I understand the Gambia is not a concrete environment where every floor, every place is concrete, like from house to house, and you have pipes that are in advanced countries goes down the drainage system and goes to the river. I understand that we haven't even get enough food to eat and medicine to help ourselves to build that kind of infrastructure. But please don't tell me that the communities, our governments, we cannot do at least at minimum something to make sure that the water finds its way somewhere, and then eventually to the river. Because if we don't do that, we're gonna be having this kind of destruction, and it doesn't make any sense. You're trying to build a country and you are getting it destroyed because of natural gifts that's supposed to be helping us. I love rain. Like you said, when it rains, we used to take our clothes when we were little, jump on the rain, samana, hey, nkara combo fankodo, rain is supposed to be nature. We even drink rainwater. It's not a joke. We used to even put water there and say this one come from, heaven or whatever you call it, and we even drink it. It might be some health issue. As a health expert, it might be some health issue related to that. I'm not sure. Some rain coming from the sky. I drank it when I was little, so I have to be honest to you. But but these are nature. I'm just trying to emphasize the nature side of it. So that being said, rain is a good thing. It helps the plants to grow. You need near that tier fuel. So some of us who farm in the farms, then when the rain hits the farm, I'm telling you, the following day you go, Tiol Bekatara happening. You can see from the groundnuts, their skin start to change colors. That is the blessing of rain. So rain is good. So if you are in the Combo area and places where waterways are, densely is dense in population, they are not good waterways, roads are bad, there's trench everywhere. I think we have to sit down, sit with your local government, your local official, your mayor, your councillors, and talk to them. Tell them, listen, we have a problem of rain destroying our properties here. What can we do? There must be a way that this rainwater can be diverted. It doesn't take you millions to do that. Work with your local officers, make community organization. I'll test the kafolo. I'll test the kafolo. I'll work together. I'll make sure that you can jantinya. I mean, I'm pretty sure there are, people there with at least some architectural ideas to help, see how the water can run smoothly. So I think, this is something that the community, beside the government, should take responsibility of. I know we want everything to be done for us, but if the government is not doing it, it's not in their priority list. Let the local government or local officials or even community take it in with their responsibility. It's not hard. The rain season is only 3 to 4 years. I mean, sorry, 3 to 4 months in a year. What is the big deal? Let's do it. Let's build our community. Okay. So if you don't have anything to add to this, I think we can wrap up because we over 1 o'clock, and then yeah.
Yeah.
What's your final word, Sam?
Yeah, I mean, again, finally, is just to encourage our government to really look into all of these and prioritize things, to make sure that our hospitals are taken care of and are equipped with the right supplies and the right doctors, and take care of the facilities and be able to be prepared to take care of our patients there, Gambian people. That's very important. The healthcare sector is very important, and everything is, like I said, Gambia is full of problems, and everything has to start somewhere. You've got to start something. Make a model of the Banjul Hospital, the RVTH in Banjul. Make it a model, then bring others from other places to come and learn and train there, then send them out to other places. But also uh, get a recruiting system in place, getting new people going to the hospital to become nurses, sorry, going to the university to become nurses, really recruit them and bring them in and create opportunities, make the other ones retire. The ones that need to retire them, get them out of the system, bring the fresh people in there, hopefully with a fresh mindset. And I hopefully that they will teach them customer service as well. If not, customer service will be something that they really need to send people to get customer service training, get them into the hospitals and operate and move the country forward in terms of the health sector. The drainage system, again, you nailed it, is important. And I don't know what they can do right now with natural waterways being blocked, because we built so much property and every land is being sold. There are certain areas that are waterway, the water path, and the local government and fiscal planning, especially the local government, should have said, no, you cannot build a house here. This is a way for the water to for water flow to go to the river. Nobody should be able to build anything in there, and keep it that way. So when water comes, rain will have a path to go back to the river, rather than building there, and they block all the passage. That makes the water to stand in our community and becomes a health hazard. So they need to look at that. One way is really homes that are built in those areas, to start collecting taxes from them and build something for them that will go help them with the drainage system and build a good system. So overall, it's a great topic, two great topics, and we can really dive more into it, but we've exhausted the time, so I think it's a good time to end this here.
Yes.
Thank you.
So we thank you all again. We probably will have to grab local government officials and folks who and the mayor's office or some environmentalists to work on the waste. Next topic, we should look into waste materials, in the Gambia, how they need to be disposed and how we can get of it, because it's killing people. It's definitely, either we know it or not, our waste are really causing us a lot of harm. So next week we're gonna have Dr. Cisse with us. He's I think Citizen Alliance member, and then he would be here to discuss more on some of these issues, especially for the youths. So stay tuned next week with Dr. Cisse on our show. And Sam, Dr. Cisse confirms, so everything should be okay. We should get the flyers out, and then we will have a tough discussion with him on the show. We'll be ready for him.
All right.
All right, Sam. Alice, we miss you on the show today, but you catch up next week. Thank you so
Yeah.
much, Sam, for your time and your dedication for Gambian people and Gambian cause. And I think, this is a great discussion, and our viewers would get some takeaway from it. Thank you.
Yep. Thank you.
All right. See you next week.
Yep.
Take
All
care.
right. See ya.
Okay. Take care.